So you saw a bit of the experience that we had inside the COVID-19 hospital, dedicated COVID-19 hospital. India has crossed more than 1 lakh cases. Delhi has crossed more than 10,000 cases. With the lockdown easing out, with in the more restrictions being in fact taken off, the expectation is that there would be more patients which would be coming into the, possibly as far as the coronavirus is concerned. And at that point of time, the fight will shift here. These are the hospitals which will be at the forefront of this fight. The private, the public healthcare system, which at least for the government of Delhi says that is now prepared to take 40,000 cases. And in that crucial fight, Lok Nayak Hospital is going to play one of the most important role. Protocols have been set in. It took months before doctors were trained to get inside a PPE and to treat the patients as far as coronavirus goes. And now the hospital says they are prepared. Challenges are still there. Every death is demoralizing. Most patients that we saw in the ICU were people, those who were elderly. But that doesn't take away from the fact that these doctors are working day in, day out, 12-hour shift inside the PPE. I was in the PPE for only half an hour, and that told me another struggle as far as these doctors are concerned. You have to work with a very limited vision, your glasses fogging up, hardly able to hear not only the patient but yourself as well. This is the struggle and the challenges in front of the doctors of LNJP. Take a look at our detailed ground report of what we saw inside the hospital today. On the front lines of this war against coronavirus, all across the country are the government hospital, the public health system. In the national capital, the very war against coronavirus is being fought in one of the largest hospitals, the oldest, one of the oldest, in fact, in the national capital, Delhi. That is the Lok Nayak Hospital. I am right now at the Lok Nayak Hospital, and this is an exclusive privilege that we have got to take you inside a dedicated COVID hospital. This is the hospital where maximum number of patients are being treated when it comes to the national capital, Delhi. With me, Professor Suresh. He is the medical director, head of the COVID task force. It's a very, very crucial time to be heading an operation of a hospital which has been converted completely, sir, only for COVID-19 patients.
This is one of the hospital which is entirely COVID care hospital, and dedicated corona care facility started since last 2 months. We have the maximum number of patients in the country. We have successfully treated more than 1,300 cases, and if you see the today's cumulative figure also, they are more than 2,200 patients so far. We have all type of patients. Patients who are critically ill, who require ICU cares. We have patients who are on dialysis. So dialysis is not done in most of city hospitals.
Let's try and take you now for a very exclusive inside peek at the hospital, which is the forefront of this fight against coronavirus. Just be going inside just to give you a sense of where the patients come in. At this point of time, I don't require a PPE kit. This is just a protective gown. We just get inside this so that we not only save ourselves from contamination, but also this entire area can be saved from any contamination through me. The first step when you enter this hospital would be this. This used to be the emergency side. From the other side, it used to be the emergency block. Now, casualty block has completely been changed for receiving the patients, those who come in. So this is where the patients, those who come, this is where they were, their initial analysis is done by one of the doctor who is completely wearing a PPE kit. As I told you before, this is just a protective gown so that not only any contamination from me doesn't decontaminate this entire area, but also a little bit of protection as far as this entire area is concerned. Dr. Kapil, what is it that you and I are wearing? I mean, how much protection does it provide us?
Yeah, this is not a full protection actually. For the full protection, we have to wear PP kits.
Yeah.
And now what we are wearing is the gown. Okay. This is for the protection of the body, and we have gloves also, and we have N95 mask. Okay. So it will prevent the virus from inhaling, and we have head cap. This is the face shield.
I'm wearing this gown and it's already uncomfortable. It's very hot. I'm already starting to sweat. A PPE kit is many times more than what I'm wearing right now. How uncomfortable is to be in this kit for such long hours?
See, it is very uncomfortable and we sweat like anything. Okay, so what you are wearing is just the basic PPE. This is for the people who are not in direct contact with the patients. We have to wear it because we in high risk areas, plus we have to deal with the COVID positive patients.
What are the difficulties when you are in fact making an assessment on the patient, because you are also, the vision is little limited, you can't, the people can't hear you properly.
Because we have 2-3 layers of mask plus this shield, so it really becomes tough to try to contact what we are trying to say. And a lot of times, very serious patients are coming, then we can't just tell them what we want you to do.
Yeah.
We have to make them understand, we literally have to position them and then do the things what we are trying to do. Like take the vitals and everything. So, yeah.
Is there a worry, you must be having a family about your, going back home, they getting infected, or they worried about you being right where the COVID-19 patients are?
So since the time this COVID has started, we are not in contact with our families. Just by the video calls and phones we are talking with them. Otherwise we can't risk their lives. So
this entire area that you see, this is the only area where the set of people, those who are working here, are allowed. They are not allowed to go anywhere else. A 12-hour shift, 2 PPEs a day, 6 hours continuously in one PPE. You can't drink water, you can't go to the loo, you can't eat. Absolutely fascinating, astonishing to see the amount of dedication and the work these doctors are doing here in the COVID-19 wards. We are privileged to have an access to the ICU. We'll be going inside the ICU as well. But before that, there is a full briefing that needs to be done.
Each ICU, this ICU 4 floors, we have 15 patients. And on second floor, we have 10 patients. All are very sick. I let you, Corona is not a killer, right? It gives you lots of mental stress, no physical. So I think कि मेरी जो प्रायोरिटी है कि हेल्थ केयर वर्कर्स को हम कैसे बचाएं फ्रॉम दी कोरोना. वो क्या है कि हमने सेपरेट एंट्री एंड एग्जिट पॉइंट बनाए हैं इन आईसीयू कि कहाँ से पेशेंट आएगा और कहाँ से जाएगा. एंड दिस इज टोटल नॉन इन्फेक्टिव एरिया. दिस इज कॉल्ड एज ग्रीन जोन. सो यू कैन वॉक एंड ईट एंड ड्रिंक. Patients are inside. And for patient, we have different staff who wear this kit, PPE.
The personal protection equipment.
Yeah. It gives a full protection. Only thing is we have to maintain the social distance, which is 1 to 2 meters. And this mask is very, very important.
So before we go inside, we'll be required to put ourselves in a personal protection kit. It's a tedious process. Step by step, you have to wear it. It's a process, you have to be very careful about while wearing and removing it. I'm now going to get inside a PPE kit so that we can go to the ICU and see where exactly the real fight for the patient, those who are seriously ill, how they are being treated here at the LNJP Hospital.
Both hands.
My glasses are already fogging. I'm in a complete PPE with a face shield, mask behind this, scrubs, and then over it a complete PPE with the shoe cover and one pair of gloves. There'll be another pair of gloves when I'll be entering inside.
this is just my beginning. Doctors, remember, those who are working here are inside this kit for at least 6 hours. And at least couple of hours before they go inside this kit, they stop drinking water, they don't eat anything so that they don't have to take it out, they don't have to go and use the washroom. This is just the beginning of this whole experience, just to try and understand how difficult it is, in fact, to work in these cumbersome PPE. It's taken me about 15 to 20 minutes to get inside this. It will take me longer to get outside because that's a cumbersome process, but we'll get to it when we are coming out of the ICU.
And this area is known as donning area.
So from the donning area, now we'll be walking towards the ICU.
This is non-infective area. You can walk safely, right? Without this device, you can go, right? And from there, from that point, we take patient. Come, I will show you from that point.
Let's now take you to the real front line of the fight against COVID-19, the ICU, the intensive care unit, where the critical patients of COVID-19 are being treated. So we are entering now we are inside the ICU at the LNJP Hospital. There are about 15 beds here which are treating COVID-19 patients, and we'll try and understand how things are working there. What kind of patients do you usually get in the ICU, and what is the kind of treatment that you start for them?
We are getting usually the moderate to severe type of patients. Rest of the mild symptomatic patients are kept in new medical block and also new surgical block, and that is managed by different residents. And the frontline, we, the anesthesiologist and the medicine people are seeing, and even the pulmonary medicine team people. Here the most of the patients are in moderate to severe respiratory distress condition, and all of them are COVID positive and some of them are COVID suspect, and we are awaiting for the reports of them. And if it comes to be COVID negative, we will shift out the patient. And all these patients are in oxygen support. The main treatment protocol is we have to supplement oxygen to every patient. Here all the patient is getting oxygen either through the normal mask we are getting, or through the non-rebreathing mask, or some thrive is there. That is some medical term. For these patients we are giving thrive for them. Okay, and also chloroquine we are giving. These are all experimental treatments we are giving here, and plasma therapy also has started, and it is also showing some good results. And
so are there any patients those who are on ventilator or anything, that kind of a support as well here?
Yeah, most of the patients are having the features of acute respiratory distress syndrome. This means that patient is not able to breathe so well, and the oxygen level in the blood is getting very low. And we are mostly avoiding ventilators because we have seen the research in the West that most of the 60 to 70% of the patients who are going into ventilator are not able to come back. So we are avoiding for the maximum, but we have also patients in ventilators also.
Abhi aapka shift, your shift right now?
Sorry?
Your shift right now. It's difficult to even listen to what I am saying in the PPE.
Yes, because of PP, it's very difficult to listen. Na?
How many patients? अभी 15 पेशेंट हैं आपके
हाँ,
पास?
15 पेशेंट, ICU full, अभी बेड्स आर फुल. Yes.
How difficult it is? Normal टाइम में भी ICU में बहुत स्ट्रेस रहता है. अभी COVID-19 को लेकर how difficult it is the stress more?
Yes, it is. I think the stress level has doubled up. If the patient beds are full and the COVID का जो phobia है and a lot of stress regarding it, we are staying away from the families, away from the kids and working, staying alone in the hotels. That is all adding to our stress, and either working with the COVID patient is another stress. So the environment has become very stressful for us.
अभी ठीक लग रहा है आपको?
हाँ, अभी ठीक है, बस रिपोर्ट आने का इंतजार है.
रिपोर्ट का वेट कर रहे हैं. अभी जब सब डॉक्टर्स वगैरह को इसमें किट में देखते हैं तो घबराहट होती है सबको ऐसे?
नहीं, अब कोई तो नहीं होती, पहले होती थी.
शुरुआत में होती थी. और घर वालों से बात हो पाई आपकी? फोन है आपके पास?
कॉल होता है.
उन्हें बता रहे हो आप?
हाँ.
सब ठीक है. अब डिस्चार्ज होने का है आपका टाइम?
जल्दी से जल्दी.
बहुत.
बस ये कहने मैं बेटी का मैं सीधी भागूंगी यहाँ से.
हाँ, एक बार बोल दे तो बस बाहर यहाँ से सीधा. बहुत सारे लोगों को जो देख रहे हैं उनको समझ नहीं आया है अभी कि किस तरीके का ये डिजीज है. घबराहट बहुत ज्यादा है, तो उनको आप क्या बोलना चाहोगे? ठीक हो जाता है?
स्ट्रॉन्ग रहे अपने में, जैसे मैं हूँ.
So how long has she spent in the ICU?
in the ICU she has spent for around 6 days, and before she was in the ward.
6 days in the ICU.
And now she's feeling better, so will you be shifting her back to the ward?
No, yeah, in the ward there is mild symptomatic patient. So she will go to that ward, and after that, when the results comes negative, she can go for the quarantine and to the relatives.
There is, in fact, doctor is telling us that there is a technician from this very hospital who got infected. So, as we were telling you earlier, that the risk is there also for the medical workers, the health professionals, when it comes to COVID-19. One of LNJP's own technician, he got infected with COVID-19. So what symptoms did he come in with? Where does he work?
With fever and shortness of breath. He came with fever and shortness of breath, and he itself asked for ICU. And he is our own technician, Karan Singh ji.
Technician in which lab?
In our anesthesia department. He was the store in charge. He is the most experienced, and he was awaiting his tenure. Next month he is going to complete his tenure. Okay. And he came to be positive, so we have taken up him because he wanted better care, and we will take care of him.
But this is also a danger, your own staff, because you guys are working in a high viral load area of getting infected.
Yeah, in the starting when some of our PGs were getting posted, and out of which 5 to 6 PGs, 5 to 6 residents in our department only, because we are working in a very high risk area. So there is much chances of getting us positive, but it's our job to do the work done, so we will do it.
But you've also not seen your family for a long time. Does it play in your mind? Is it difficult emotionally?
Yeah, it is.
Who all do you have in your family?
Yeah, I have been to home last 4 months, because I have never been to home for the last 4 months. I am from Kerala, and I am hoping to go to home because my wife is expecting on last month of June.
Oh.
And it is.
Congratulations, by the way.
But it is difficulty to go home right now, and also we are facing all these situations.
Yeah.
And I am myself afraid of chances of getting positive is higher. But it is my work to do this, madam. It is my work. I have to do it. I will do it.
We would not want to spend a lot of time here inside the ICU, not only because it's a very high viral load. It could be a problem for us as well. And at this point of time, it just would not be right, and also putting all the patients here and the doctors, those who are working, in any sort of risk as well. After being in the ICU for about 20 minutes, we were told we need to get out because we are unnecessarily also risking ourselves being in the ICU for a long time. Now, multiple times, not only Dr. Nadeem, the senior resident here, but everybody else who are present in the hospital had told us that the coming out of the PP is a more cumbersome process, and it requires absolute precision, because that is the time when you can get infected. We will be in fact told how to take it off, and this process also takes about 15 minutes. We will now in fact go across and go through the entire process of taking off the PPE. We are now going to change out of these scrubs as well, but 30 minutes into the PPE kit, it was very difficult to function, and I just want to show you something. I was in the PPE kit for some time. Look at the markings on my face. These doctors go through this for 6 hours every single day in one go, and then change into another 6 hours schedule. We have just come out from the most infection-prone area, the ICU, and the main areas where the patients are being treated. And Dr. Suresh has just come out to meet us. We don't want to go inside because we've come from the highly infected area. Otherwise, everything will have to be desanitized once again. It is a lot of difficult circumstances that your staff is working in.
Yeah, you are right. You have visited our facilities. You have visited the most critical area of the hospital, that is the ICU. You have visited 2nd floor, 3rd floor, 4th floor and 5th floor. We have all very sick patients, those who are really requiring life supports and advanced ICU care. And you have seen that these patients are not fully conscious, they are drowsy, their oxygen saturation is low, and they are more prone for complication, respiratory failures and multi-organ dysfunction. With the best team available with us from the anesthesia department and all other department, they are doing their maximum to save the human lives. And you have seen how much the number of staff, nurses, paramedics, doctor, how sincere they were inside the ICU.
Absolutely.
And you have seen the difficulties in managing these patients, because these patients are infected, and this infection can be transmitted to the healthcare worker. Our doctors are working for 8 hours, and some of the doctors are working for 10 to 12 hours per day, continuously for 2 weeks, 3 weeks. You can imagine how difficult time we are facing in managing the COVID-19 patients. But still they are motivated, and their aim is to save the human life, and they are so good that they have to maintain the highest standard of patient care.
Thank you so much for letting us into your hospital, for giving us a brief about how, in fact, the entire situation, I mean, it's a cliche, I've been using it since morning, but this actually is the front line in the war against coronavirus, and you met the warriors here on India Today.
Thank you.
Hello everyone, this is Rahul Kamal here. Hope you enjoyed this video. For the latest news and analysis, like and subscribe the India Today YouTube channel, and don't forget to press the bell icon to stay updated.